Well, so we are in the final week of our course. We're considering contemporary issues and the future of pharmacy. And I'm very happy to have with us an individual from the American Pharmacists Association. Her name is Ann Burns. She is Vice President for Professional Affairs. And we've talked about APHA a lot in the last 7 weeks. So it's really an honor and a privilege to have Ann Burns with us. And she's sitting in this recording actually at APHA headquarters in Washington, D.C. So Ann, it's a great pleasure to have you with us. Thank you for joining us. And I'm going to, thank you so much. We're going to talk a little bit about the future with you because you have your hands on a lot of the issues we've talked about in this course that really have a bearing on our future. So let me start off by asking you this question. You are a leader in one of our big national associations, and you've been involved in many of the activities we've talked about. So what do you see as some of the contemporary factors that are really going to shape the future of this field?
Well, I would say that there are really three big areas that we're following right now that really seem to be impacting healthcare in a major way. The first is movement across the United States to better coordinate the care of individuals. I'm sure that everyone knows a relative or a friend who sometimes just slips through the cracks in the healthcare system. And so there are a lot of really innovative and interesting new types of programs like medical homes and accountable care organizations that are working diligently to both improve the quality of care that's being delivered, make sure that it's more coordinated, and also make sure that it's more cost effective. And we're very, very focused on making sure that pharmacists are part of those models. Along with that, two other areas that are really transforming healthcare are quality, in other words, being measured for the care that's delivered. Think of it a lot like consumer reports or the report cards that come out on universities when students are trying to decide what college they want to go to. In this country, the United States really ranks below a lot of other developed countries in the quality of care that we deliver. And so there's a big movement underway to try to measure the quality of care that different providers are contributing to the healthcare system. And doing that right is a work in progress right now, but it is a big focus in health policy circles. And then the last area that really seems to be underpinning both quality and coordination of care is health information technology. And how can we use the interconnectedness of technology to better connect providers, hospitals, long-term care settings so that important information about patients doesn't slip through the cracks?
Fantastic. So you've talked about coordination of care, and we've talked a lot on our course about collaborative practices and about the idea of working in a healthcare team. Even transitions of care has been something we've talked about. All that fits into that scenario, doesn't it?
Definitely. We see all of those things you just mentioned, Ken, as just wonderful opportunities for pharmacists to contribute their expertise related to medications and really related to healthcare in general.
Great. Well, Ann, one of the things we've actually talked about in one of our content videos this week is provider status. And I know that you've been really involved in those discussions at the national level. So, we've kind of defined what provider status means to our students. But from your standpoint, why is this such a big deal for our future?
Well, first of all, we define provider status as making sure that pharmacists are valued and recognized in the healthcare system. And those two components really underpin whether or not pharmacists will be part of the healthcare team moving forward. In other words, a healthcare organization, whether it's a medical home or a hospital or even an insurance company, needs to value the contributions that pharmacists can make. And then there really needs to be some type of coverage for those services in order to make them financially viable. I think all pharmacists go to school with the thought that they're going to help people, That's an underpinning for being a good healthcare provider. But there has to be the financial support of that healthcare provider in order for those services to continue in the long run. And so we feel strongly, as do a number of other pharmacy organizations, that both value and recognition are going to be important to making sure that pharmacists are a viable member of the healthcare team.
Yeah, you bet. And another topic that we've discussed this week as a contemporary issue relates to the use of telemedicine and telepharmacy, telehealth. And I'm wondering, I know that you've paid attention to this one as well, so how do you see telepharmacy changing the trajectory that we might be on in this profession?
Well, I think telemedicine is going to be changing the trajectory across a number of different healthcare professionals. And when you think about the society that we live in today, especially the younger generation, but really the older generation more and more as well, everything is based on convenience. It's based on connectedness through different types of venues. And because of that, and also because of the fact that especially in rural areas, we have healthcare providers shortages where there are lots of areas that aren't served by any healthcare provider. We have to really think about out-of-the-box innovative strategies for reaching people both in a way that is effective but also convenient. So there's a segment of our population who doesn't want to be bothered with going into a healthcare facility if they can avoid it, and would welcome the opportunity to have a conversation with a healthcare provider in their own home. Likewise, there are patients who don't have access to a healthcare provider, and we have to find a way of getting healthcare to those providers. Obviously, having both video conferencing and audio is going to be most effective in delivering care in order for the healthcare provider to be able to assess how the patient's doing in the most meaningful way. And there are a lot of really exciting projects that are underway to look at what types of care can we deliver most effectively using telemedicine. And that applies to pharmacy as well. There are a number of medication management services that are being delivered over the phone where the pharmacist talks to the patient, runs through their medications with them, learns about how they're using them, makes recommendations to their physician, and people are very positive when it's done well. So we need to find how to do it effectively. I think that's the most important thing. We shouldn't look at it as a replacement for all of healthcare, but it certainly will have its place moving forward.
Yeah, thank you. Well, another issue that certainly our viewers of these videos are going to be keenly interested in is workforce issues. And so we know that we've in pharmacy done a pretty good job of monitoring where we're headed in terms of workforce. And we've kind of, I think, better than most professions, actually. And we know that we're in somewhat of a balance right now in terms of supply and demand of pharmacists across the country, and there are pockets of differences in various areas geographically. But so, we seem to be pretty much in a balance right now. As we move forward, Ann, from what you see, I mean, what factors do you see that could really tip that balance one way or the other?
I think it's a great question, and really it could, if you're thinking of a scale, it could go to either side depending on how some of the efforts that we've talked about so far move forward. On the positive side, if we are able to better integrate pharmacists into healthcare teams and increasingly use the pharmacist for their medication therapy expertise, then we could go back, depending on how many students we're producing every year, we could go back to a shortage situation because we will need more pharmacists to serve in those roles. On the flip side, when we look at pharmacists involved in the distribution process, there are a number of different entities that are going to what are called central fill. I don't know if you've talked about that in the class or not, but it's more centralizing the actual filling of prescriptions using robots and other technology, as well as well-trained technicians to fill prescriptions. And then pharmacists are used for the cognitive aspects of reviewing the patient's profile, educating the patients about their medication. As we move more and more to technology for the distribution process, there is a very high likelihood that we won't need as many pharmacists for those roles. So we are increasingly, I would say, are seeing pharmacists being used more and more, really, and this is a good thing, for the cognitive skills that they develop through their well-founded training.
Thanks, Ann.
I would say it's kind of hard to predict.
It's hard to predict, but there are
It is hard.
many moving parts and many factors that could change these things. Well, we're running short on time, but I'd be interested in, just as we conclude, just your brief thoughts on, 25 years from now, what do you think pharmacists are doing in the United States?
That's a great question as well, and I thought long and hard about this because we tend to think of 5 to 10 years because those seem to be time frames that you can bite off a little bit easier and maybe have more of a crystal ball. But I really see pharmacists will, as I mentioned earlier, will increasingly be used more and more for their expertise in medications, either advising physicians and other healthcare providers, advising the team, working with highly complex patients. I think we'll continue to go more and more away from the distribution of products, but I think pharmacists will be used in managing drug distribution systems. And I often think of as I thought about this, I often think of like the Star Treks and some of the ways that medicine would be depicted. And I think for providers to remain relevant, it's going to be making sure that the expertise and contributions that they can bring to the patient and helping to solve the problems within the healthcare system are going to be where the sweet spot is. So I think that's a really hard question 25 years from now because medicine is evolving at such a rapid pace right now. I think 5 to 10 to 15 probably what I described is realistic, and from there, just not sure.
Yep. It's a good guess, though. I think you've got a lot of the factors at the tip of your tongue there in terms of what might change that future. So, Ann, thank you for being with us. It's been a real pleasure talking with you, and thank you for all you've done for our profession through your work at APHA.
Thanks, Ken, and I really appreciate this opportunity, and I think it's a really exciting time to be a pharmacist, and so this course is a really great mechanism for helping people to understand the valuable contributions that pharmacists make every day.
Thank you, Ann.